Good morning, everyone, and welcome to Innovation Expo 2021. My name is Jillian Strudwick, and I am the Interim Chief Nursing Executive and a scientist here at CAMH, and I will be your MC for today. This is our third Innovation Expo and the first ever virtual innovation event at CAMH, and we are currently live on Facebook as well as on Innovationexpo.camh.ca. I'm so glad to see so many of you were able to join and make it to our event today. And if you're on Twitter, be sure to follow the event via the hashtag CAMH Innovation Expo. Here's what's in store for today. So to kick off our event, we will have some brief opening remarks and a keynote speaker. We will then move to a discussion panel featuring some industry experts and thought leaders to speak to you about the experiences and how they drive innovation in their own work. We will then move to the CAMH pitch competition, a Dragon's Den style event where 3 teams will present their innovation in front of a panel of judges for a chance to win $50,000 in funding, supported by Gifts of Light, and to support the implementation of their work at CAMH. We'll also be doing a prize draw later in the event, so stay tuned for details for that. And without further ado, allow me to introduce Dr. Damian Yankovic to deliver our opening remarks. Take it away, Damian.
Good morning, everyone. It is really fantastic to see such a great turnout, especially with the incredible challenges in our environment right now. I'm so thankful for this opportunity to come together virtually to reimagine the role of innovation in mental health and at CAMH, especially now as demands for our services increase, health disparities are amplified, and we navigate out of the pandemic. Often, I think people consider innovation as a nice to have, something that happens, when the real work is done or, off the side of your desk. Over the last 13 months, we learned that innovation is not a nice to have, but a must have. Yes, innovation was driven by urgent real world conditions over the last 13 months. I hope it leaves us with a sense of urgency to challenge the status quo and change how we do things. Judging by the record number of entries this year, CAMH staff agree that innovation is central to what we do. We had 21 teams pitch their ideas to a selection committee this year. You'll see the 3 finalists. We had a representation from nearly all departments and incredibly the largest contingent of clinical staff. About half of the participants were clinicians. Innovation has to solve real problems, and at CAMH it does. So with that, welcome to our third Innovation Expo. To kick us off, I'd like to introduce our keynote speaker, Laura Manley. Laura Manley is the director of the Technology and Public Purpose Project, Harvard Kennedy School, Belfer Center for Science and International Affairs. The project aims to steer rapid technology-driven change in directions that serve long-term public good. At TAP, Laura launched several new initiatives, including the TAP Fellowship, Tech Fact Sheets for Policymakers series, and the Tech Spotlight to make advances in tech more inclusive, safer, and fairer. She has also testified twice before Congress on her research to improve science and technology expertise in government. Please take it away, Laura.
All right. Thank you so much for having me today. I'm really thrilled to be joining all of you. Today, I want to talk to you about getting the good without the bad with tech and mental health. So as Damian mentioned, my name is Laura Manley, and I'm the director of the Technology and Public Purpose Project based at the Harvard Kennedy School. Our mission is to ensure that emerging technologies are developed and managed in ways that protect the public good. And a huge part of public good is mental health, which is where I spent several years of my career prior to joining the tech community. I'd like to start by normalizing mental health. It's estimated that 1 in 4 people in the world are affected by some type of mental health disorder. Anxiety, depression, bipolar disorder, and other conditions are more common than most people realize. And now with the global pandemic, mental health for millions has been devastated. Illness, fear, and illness, social isolation, economic insecurity, disruptions of routines, and loss of loved ones are known risks for depression and anxiety. And those experiences have been our lived reality for much of 2020 and into 2021. We're at a once-in-a-century type of moment here. The whole world is going through a collective trauma. One of the few silver linings to this moment is that more people are talking about their mental health struggles, and we as a society are beginning to normalize the conversation. We now have a new opportunity. With this awareness and emphasis on mental health, we can begin to push new frontiers of what's possible. Tech is one of those opportunities. Mobile devices like smartphones, tablets, and wearables are giving the public, professionals, and researchers new ways to access, help, monitor, and progress a new understanding of mental health. There are lots of clear benefits here, like convenience and 24/7 service, greater anonymity, providing a more accessible introduction to care, lower costs, scalability and reach, and consistent treatment and access to care. But of course, there are many new challenges to these technologies being used for mental health. More specifically, concerns about effectiveness, apps and programs for whom and for what, data privacy, lack of guidance for users, lack of government regulation and oversight, and overselling. So, how do we get the benefits of tech for mental health while minimizing the harms? Part of what shaped our innovation ecosystem are the underlying norms of today's tech culture. These norms dictate conscious and subconscious behaviors that inform how technologies are invented, developed, tested, and scaled. I believe we can start to get more out of the good while minimizing harms if we reevaluate some of today's tech norms for mental health. This includes our accelerationist culture, our tailoring to specific users, and how we apply our values and priorities to our innovations. Let's start with our accelerationist culture. Have you ever heard the phrase, everything that is not forbidden is allowed? This concept is a deep and underlying part of the tech innovation community, which actually stems from English law. The converse principle, everything that is not allowed is forbidden, used to apply to public authorities whose actions were limited to the powers explicitly granted to them by law. This concept of experimentation, innovation, and pushing the boundaries is a defining characteristic of today's tech culture. Now, what does that concept look like in practice and when you add an element of speed? We move fast and we break things. We've heard the phrases like Facebook's original motto. We've heard fail fast, fail early. Innovation, speed, and growth have almost always been central to tech's self-conception. In terms of mental health, people are rushing to develop new apps for any and every type of mental health disorder. There are now an estimated 25,000 apps available for download on the iTunes and Google Play stores. In some cases, this rush to develop solutions makes it more difficult for consumers and clinicians to identify what's evidence-based and what might work versus what could be harmful. Furthermore, some things just shouldn't be sped up, reduced, or simplified, like evaluating fairness, efficacy, and ethics. When we're moving so fast that we don't consider the potential unintended impacts of our products, we often miss very important things that might not be worth the price of rapid innovation. Another norm of today's tech innovation is the emphasis on tailored products to specific users. Much of this has been driven by the customer-centered design community and the increasing demands for products to be highly personalized. This does have many benefits. Tailoring products and services to the specific needs of users helps ensure that innovations are filling a critical unmet need. But mental health is not the place to tailor to users without first doing your homework. Currently, many mental health apps are developed for individuals with certain disorders. This is a good thing. However, there's a wide spectrum of variability on how an individual experiences a mental health disorder and what their symptoms are. Furthermore, there's often a big difference between who uses a product and who it was actually designed for. At present in the US, there's no industry-wide standards or regulation to help consumers know if an app or other mobile technology is proven effective. When you design so specifically for one user, you might wind up leading a slightly different user to incorrectly self-diagnose or provide harmful advice. Unfortunately, it's very difficult for many technologists and founders to imagine how their technology that was developed with good intentions might actually be used incorrectly or create harms. Nevertheless, considering dual or unintended uses of your technology is critical. The last norm of today's tech innovation is how we apply our values and priorities. A founder's values and priorities have always driven how a product or startup is designed, but in recent years, we've seen the tech community's underlying values put on display as we use their devices in our everyday and sometimes every hourly interactions. It's up to us to carefully examine which values and priorities are implicitly or explicitly influencing how we build new technologies. Mental health apps deal with very, very sensitive personal information. So developers need to be able to guarantee privacy for app users. But at what point should you share someone's personal data? If their life is at risk? How do you know if it truly is, and what are the trade-offs? In the US, we've seen some companies set policies that undervalue issues such as personal data privacy in pursuit of other goals, such as free expression and universal access to their platforms. These critical questions anyone in the mental health field should be asking. If I'm prioritizing user friendliness and accessibility, what am I deprioritizing? If I'm prioritizing data privacy, what else is getting bumped further down? Whether or not we know it, we're making these decisions, so it's better to be mindful of what they are. To close, here are a few tips on how to get the good out of tech while minimizing the harms for mental health. 1. Speed is not the most important thing. Take the time to incorporate evidence based practices. 2. Understand existing options in the healthcare industry and decide if your solution actually adds unique value. 3. Define, educate yourself, and engage with your intended audience. Don't assume your solution is for everyone. 4. Be clear about your priorities and values that inform development. Make sure to consider security risks, data privacy, and potential externalities of your decisions. And 5, don't underestimate the impact of stigma. As a society, we've leveraged the norms of technology innovation to do amazing things. It's up to us to make sure that we take action to mitigate the risks and unintended consequences of tech. That way, we can ensure that the net effect on the public is positive. Thank you. Do you have any advice on how we can better co-design with patients' family to develop more personalized products? Yes, bring them in as soon as possible, preferably before you start developing. Anyone that you want to be using your technology or product, you should be consulting with along the entire process and as early as possible.
Thank you so much, Laura, for a very insightful presentation. You've certainly given us a lot to think about. Before we move into the panel discussion, I am excited to welcome and introduce our panelists who will also be acting as judges for our CAMH pitch competition. So first is our very own Dr. Catherine Zahn. Dr. Zahn is the president and CEO of CAMH, and she is a champion for the integration of psychiatry and neuroscience, working to steer mental illness into the mainstream of medicine and promoting equitable access to healthcare resources for people with mental illness. She is leading CAMH through a major expansion and renewal phase and has attracted Canada's leading philanthropic support for research in mental illness and addiction. Next, we have Abdullah Snowbar. Abdullah is the executive director of the DMZ and the CEO of DMZ Ventures. He is responsible for the strategic direction and continued growth of both organizations. Under his leadership, the DMZ built a presence for Canadian startups to grow in New York City and was ranked as the #1 tech incubator accelerator in the world by UBI Global. In May 2020, Abdullah was appointed CEO of DMZ Ventures, the for-profit arm of the DMZ dedicated to scaling high-growth startups and supporting them with seed capital investments. Finally, we have Lydia Lee. Lydia Lee is a partner at KPMG Canada. She is the national leader for digital health and CIO advisory practices. With more than 25 years of experience in technology-enabled business transformation, she focuses on digital strategy, complex multi-organizational governance, information systems modernization, and data management. Prior to joining KPMG, Lydia was the Senior Vice President and CIO at UHN, University Health Network in Toronto, Canada, and this is Canada's largest academic health sciences center and learning institution. I'd like to now turn this over to Dr. Damian Yankovic, who will act as our moderator for the panel.
Good morning, everyone. Good morning. We have a fantastic panel. Thanks so much, Julian. Let's get things started. I'd like to pose our first question to our very own Dr. Catherine Zahn. Catherine, one of our strategic priorities at CAMH is digital health innovation. Can you share some thoughts, reflections on our progress in the past few years, and especially over the last year, and highlight some opportunities where we can continue growing?
Thanks, Damien. Boy, this is a hot topic for us at CAMH, and I'll start by saying that we're in the second year of our new strategic plan that's titled One CAMH, and the strategic plan has three priority strategies, and we talk about them as inspire and include for impact. And our CAMH digital health innovation strategy actually contributes to all three of those strategic priorities. But in this year of the pandemic and the important social justice movements that have taken place in the past year, the importance of their contribution to the include direction are more important than ever. And I would say that much of our early work by plan had included a focus on considering all voices and finding those where we thought they might be missing. So all that as a prelude to say that if I cast my mind back to the year 2014, I thought we were really in a hot spot when we a positive hot spot when we introduced our electronic health record. And when I think about it retrospectively, I understand that it was from a relatively narrow viewpoint, and it was very provider oriented centered at the very beginning. You know, what could this tool do for us as a hospital and as healthcare providers? But for sure, that excitement opened up the possibilities, opened our eyes to the fact that obviously the help for us was towards the end of supporting our patients. And what we realized fairly early on was that we had this incredible wealth of information that led us to capitalize on the levels of sophistication that we were able to put forward. And again, as Damien knows very well, we achieved HIMSS level 7 and HIMSS level 6 analytics designations over the past few years. So what that's evolved to is a real understanding of what our patients want, how it'll improve their lives, what are their hopes and dreams. And I can tell you quite simply, their access to the right care and supports, their social interaction. They crave help and support to adhere to their treatments and to navigate the healthcare system. And for us at CAMH, that's opened up an entire spectrum of opportunities. And I could probably list the list that all of you would know, everything from virtual care to apps to online options, virtual reality, simulation, and I'll finish by saying that we had. Well, actually, before that, I'll say that the world of mental health psychiatry has been involved in virtual care for decades, literally 25, 30 years, to support the care of individuals in remote and rural communities across the province and also across Canada. And we had very specific plans to expand that service. And at the onset of COVID, that path of expansion just took a sharp upward change in trajectory, and we underwent a massive acceleration as both in our opportunities for virtual care as well as many of the other initiatives that count on our digital capabilities, and not just focused on patient care, but capacity building across the entire healthcare system.
Thank you, Catherine. Abdullah, what are some of the things that you and your team at DMZ do to support tech startups? What can startups do to scale beyond the dreaded pilot that we all seem to be stuck in?
For sure. Thank you, Damien, and it's a pleasure to be here. maybe I'll give a quick overview about what the DMZ is just in 10 seconds, and I can tell you a bit more about what we do to support tech founders. So first off, for those who don't know, the DMZ is an incubator for technology companies across the world. Actually, we're not just Canada-based, we're globally based. And to date, the DMZ has helped more than 500 startups in building their businesses and raising over $1 billion in capital. Collectively, these companies have created well over 4,000 jobs, full-time jobs for the economy. In terms of programming and more specifically, looking at what we do, we provide founders, and you'll realize I speak a lot more to the people side of things, founders as opposed to the startup itself, because that's really who we spend our time with and who we kind of invest in. But we do provide founders with access to mentorship with an incredible list of experts from across the country who are skilled and really the best in class in what they do. We provide founders with access to capital and capital potential locally and globally. We provide them with access to talent sourcing strategies. So it's no secret, as you're building out your pilots, you're obviously going from usually 1 to 2 people all the way up to 5, 10, 15 over a period of time. And I'll speak about this later on, but one of the most fundamental parts of growing a startup is the team that you bring on with you to do this in the journey that you go in. We also help out with a lot of financial management support, marketing and sales strategies, and a lot of customer acquisition potential. So obviously, being able to find customers and generate revenue is incredibly important, and that's one of the areas that we spend a lot of time on. And fundamentally, it's really we do whatever we can to allow the business to scale their startup fast, and to do it in a way that it would be sustainable by building a proper playbook and ensuring that they have all the right resources at hand. So that's effectively the business side of things. Now, Damien, on the personal side of things, it's definitely no secret that a founder working to create a sustainable, scalable startup is going to be stressful. It's hard work. It's not meant to be easy. I don't think anyone got into this space expecting it to be easy. So there's a lot of sleepless nights, busy schedules, and the commitment to the hustle that can take real tolls on founders. And we appreciate that, and we acknowledge that, and we realize that it's a real problem. So, this is why mental health support is something that we take extremely seriously at the DMZ. One of the benefits that many founders receive with us is access to ink blot therapy. It's a digital-first mental health provider that gives affordable and accessible care to all founders in our space and obviously in other communities. It's available not just to our founders, but also to our very own staff. But pre-COVID, and I know that things have changed quite a bit since then, but pre-COVID, when we were still able to navigate and work out of a space and see each other for coffee and everything else, we always had things like nap rooms, meditation rooms, and guided meditation rooms, yoga sessions throughout the day. We had games rooms, and we always encouraged founders to take mental health breaks. And we tried creating a community of peers that would allow them to kind of work together and really understand each other's problems and learn from that, right? So we are adapting virtually, and that's, I think, the lesson that we're all learning over time. But it's been good to see how much founders have been able to pivot their own mindsets to adapt to what we're doing as well.
Thank you, Abdullah. Lydia, just sort of looking to the future, where do you think the future of digital health is heading? What will that sort of patient journey look like, do you think?
Thanks, Damien. So the question is, what do we think the future of healthcare will look like, and what does the patient journey look like in the future? So, Damien, I think that there are a number of things that we think about in other industries that apply to healthcare. So for a moment, let's talk about banking. Banking right now is not sort of the traditional 20 years ago where you'd go to a teller, you'd take out your money in person over a counter. It's all through ATM machines, and online banking services. The same kind of digital transformation is also happening in healthcare across the continuum. So not just in hospitals, but also out into the community. And so if we think about those sort of industry trends that we're seeing in other industries and now really hitting healthcare, it's really about consumerization of the patient care experience. And specifically, I know in the work that we're doing that patients are looking for opportunities for on-demand services, online services. That's certainly the case with virtual care. We've seen it in spades through COVID. That could also include getting access to online prescriptions or prescription refills to their pharmacy, potentially access to specialists. And so I think that this whole move to on-demand services is really something that the healthcare sector needs to think about. The other thing from a patient care journey perspective is that, and for sure the work that we've seen in mental health is that all of the services that patients would typically have come into a health center like CAMH to experience in person, a number of organizations are looking at how do we actually provide those on-demand, online, as a first option, not as the last resort, as we saw in COVID, but actually as the first option to provide a different kind of experience if our patients are really looking for that. So I think that's probably one of the major ways that we see changes in healthcare.
So Lydia, maybe let me stick around with you for a little bit. So you've mentioned COVID, and of course there's the mandatory question of how have things, what has COVID brought to innovation? But maybe let me ask it a little bit differently. Can the pace be sustained, do you think, of innovation?
Can the pace of innovation be sustained? I think that's a great question, Damien, and I think it depends on the organization's way of looking at it in a comprehensive fashion. So let's just look at what has happened with virtual care in light of COVID. People have quickly moved to telephone-based services where patients were able to access online video consultations. We've seen organizations move to that, but it was done, I would say, in a way that would make it as fast and easy as possible for providers to keep their clinics open, their services open. Looking at sustainment really involves a much more comprehensive examination of the processes, how the service is going to be governed eventually, the quality assurance of that service over time. So it's what we tell people is that it's really no different than looking at any other new intervention, any other care intervention of service that might be introduced to an organization. How do you sustain that? So the same kind of approach and questions need to be asked when we're looking at things like digital services or virtual care. And so I think that the pace can be maintained, Damien, but I do think that the organization needs to take a much more comprehensive look at how.
Thanks, Lydia. Abdullah, just over to you quickly. Lydia mentioned banking as another industry. What are some of the other, lessons learned, trends, tech trends, healthcare should be looking to and sort of and learning from?
For sure, yeah. Maybe I'll speak to 2 points, Damien. Number one is digitize everything. Leverage the expertise of health tech startups like OnCall and Pocket Health. These are 2 companies that came out of the DMZ. So we're seeing a huge shift away from physical paperwork, and it's no secret that in order to optimize diagnosis and treatments and predict health risks and develop long-term care plans, we need to digitize all elements of healthcare to access whole patient data. An example that I think we just mentioned was the financial sector. They've been able to ensure that digital transformation has become an integral feature in their sector, whether it's through online banking or ATMs or online investing, et cetera, et cetera. The second piece I would say is collaborate across industries. So cross-sector collaborations are a powerful force with the ability to change the course of an industry. So the healthcare industry deals with highly sensitive information, and consumers expect their healthcare experiences to be safe and secure, as we heard from Laura. And so collaborating with cybersecurity firms and experts will be an essential part to ensuring that personal information is properly protected in the long run. And one of the examples behind this is governments partnering with financial institutions now to secure government service logins. So those are just a couple quick examples that people need to consider as they kind of move forward.
Catherine, you know, all of this requires that we engage our staff, our frontline staff. We talked a little bit about the co-design and so on. You know, any thoughts around how do we engage sort of frontline clinicians in this work? How do we spread? How do we make it a fabric of the organization?
Damien, I think the answer to that sort of circles back to the original question about sustaining innovation. And it's the first thing I would say is that we have to unlock our brains when we think of innovation. It's not just technology. So when it comes to technology, yes, for sure we're going to be continuing our digital drive. But guess what? There are a bunch of things we're going to throw away because they didn't work, or because they were too expensive for what the outcome is. But we have to be more broad in our understanding of innovation. It has to include process innovation. Look how we literally in 72 hours brought people into our organization and out of our organization in an entirely different way, a way that we never thought of before, innovating to develop the process of vaccines. And then so technology, yes, important, process innovation important, but also structural innovation, often through partnerships to create a system where the whole is greater than the sum of the parts, and embracing all of those things and bringing our clinicians into help create that along with the people that we serve is absolutely key. Everybody in this organization has great ideas. It's a matter of paying attention to them and giving them a platform upon which to express their interest and their creativity.
Thank you to the panelists. Really appreciate it. With those words, let's end the panel, and I'll turn it over to Jillian to continue.
Thank you so much, Damien, and thank you to the panel for sharing your reflections and experiences. So now let's move to the CAMH pitch competition. This year, staff across CAMH got into teams to apply for a $50,000 funding from Gifts of Light towards an innovative idea that would directly impact patients at CAMH. Altogether, there were 27 applications, which were vetted by a selection committee from across the organization. And almost 300 CAMH staff also submitted a vote to select the People's Choice finalist. Today, 3 teams will be pitching to our judging panel. And here's how it's going to work. A video pitch from the team will play, and then the judges will have a chance to ask the team any questions about their ideas. Before we get started, we have a very special announcement from Gifts of Light and Donna Slate.
Hi, everybody. My name is Donna Slate. I'm the chair of the Gifts of Light Committee, and I'm on the CAMH Foundation Board. I'm pleased to be able to join you today to celebrate the creativity and innovation of our very own CAMH staff. Today's Innovation Expo winner will be receiving a $50,000 grant from the Gifts of Light program to turn their idea into reality and to enhance the care of current and future CAMH patients. Gifts of Light is a donor-funded program that provides basic necessities, special events, and unique programming to patients year-round. We serve about 14,000 people each year, and our priority is to bring comfort, care, and dignity to all patients. This wouldn't be possible without the support, creativity, and advocacy of the frontline clinicians of CAMH. Gifts of Light, we're so grateful and proud to partner with you to enable innovation to enrich the patient experience. I want to acknowledge and applaud all those who applied to this year's expo. Even amidst a global pandemic, 21 teams and individuals made the time to put forth their ideas to bring positive change to the hospital. For that, we thank you, and we encourage you to continue to advocate for the best possible care for our patients. So best of luck to everyone.
So thank you so much, Donna, for your support and kind words. This is very exciting that we're just about ready to kick off the pitch competition. So our first group presenting is the Patient and Family Digital Health Hub.
Why'd you bring me in today, Doc? My patients tell me they have trouble finding reliable health information online. Why's that? You know, the usual reasons. Too much information, not knowing who to trust. Doesn't CAMH publish its own patient-centered consumer health information? Yeah. It does, and it's world-class. CAMH has developed hundreds of accessible plain language, pamphlets, brochures, information guides, and resources. But they also tell me that stuff is very hard to find on the busy CAMH.ca website. So would it make sense to centralize these resources in one location? Yes. Optimize it for smartphone and tablet use? Mm-hmm. And make it available to people without Wi-Fi? Certainly. Well, Doc, I think I know what you need a prescription for. An app. An app? Not just any app. The Patient and Family Digital Health Hub, where clinicians can send their patients and families when they need to refer them to something in CAMH's vast library of resources related to health, mental health, and addictions. That's great. Well, I think we're done here. Here's your prescription. Take this to your nearest IT department. See you later, Doc. Thanks. Goodbye. I cannot read any of this.
Hi, I'm Andrew Johnson.
Hello, my name is Reno Lagrassa. I'm the Director of Web and Corporate Technologies.
And hi, I'm Daryl Beauchart, and on behalf of our team, I'd like to say a few more words about the Patient and Family Digital Health Hub. We all work at CAMH for personal reasons, and for each one of us, helping patients and their families is at the core. However, helping patients and families isn't just about doing things to them or for them. It's also about helping patients and family members help themselves. That means giving people knowledge to make informed choices. It means providing scientifically validated information in understandable language, meeting the patient where they're at. And it means co-creating all of CAMH's information guides, brochures, and pamphlets with patients and families so that they can see themselves reflected in the content. The Patient and Family Digital Health Hub is an extension of this commitment to patient empowerment. CAMH clinicians and staff have spent decades creating and updating a world-class catalog of patient and family-centered health information. It's time to make this information more accessible, easier to find and search, and give it a centralized and proper digital home. Thank you.
I've got a question that I wouldn't mind asking. So this is, it sounds like a fantastic way to kind of bring all the information together in one place for patients. One of my questions is, this is a huge amount of resource from across the organization. What's the sustainability of something like this in terms of keeping the information current, up to date, and timely?
One of the beauties of this, Lydia, is that it's not so much spread out across the organization. The CAMH Education and CAMH Publications is really focused on providing this work. We have established workflows to review and revise information. We have established relationships with subject matter experts, some of whom are on this call today. And so that particular issue is one that I would suggest that we have well in hand.
Let me ask just very quickly, if I go on our website, I have a lot of trouble finding information in a rational, coherent way. And what I'm picturing is this app, and it won't be just inpatients, it'll be people out of the hospital, I hope, or I think that's the real impact. How will they learn how to use it? And how will there be a training component within it that actually explains what the categories are and how they can be used and where to go if it's not working?
Thanks, Catherine. That's a great question. So, understanding that we're looking at much like Google, very simple. We want to create a what we're envisioning is a very intuitive, engaging search engine that will allow people to also, predict their text, ask questions as to, did you really mean this? And help them, drive them to those resources that they're really looking for. We want to make it as engaging, as intuitive as possible.
Mm-hmm. Thank you.
Well, thank you very much to Group 1. And we will now move along to our second group, which will be A for I, App for Independence.
Hi, my name is Sean Kidd. I'm a senior scientist at CAMH, and it's my great pleasure to present on A for I along with my colleague Wenja for the CAMH Innovation Expo. And where did this all begin? It began with my own clinical work, the people I see on Thursday evenings, people with schizophrenia and other psychoses, for whom there's really nothing in terms of digital health tools that can help them manage their illnesses and engage their providers using the devices that the vast majority are using every day. And as for the context we're working in, it's one where we need to do better. We've got an illness or set of illnesses that is very challenging and costly, both in the lives of individuals with schizophrenia and their families and to our healthcare systems. And we also need to do better in terms of our models. We rely really heavily on crisis services with less than adequate supports in the community, certainly almost nothing digital, and we're not seeing the outcomes that we hope for.
A4I is our answer to those pain points as a patient and clinician co-designed digital application and clinical portal. Our goal is to extend the reach of mental health support outside of the hospital by providing education, reducing isolation, and readmission for patients. The first thing you see when you open the application is the content feed, where A4I content provides evidence-based, personalized content curated by the A4I team, and peer-generated content can be viewed. Any submitted content is moderated and flagged for any high-risk messaging before being published. Next, reminders allow management of medications and help to improve appointment attendance. Daily check-ins are sent in the mornings and evenings to monitor mood, sleep quality, and goal progression. A4I also provides an auditory hallucination detector that teaches patients to recognize hallucinations through cognitive remediation techniques. With all of the information that is collected, all of it can be remotely viewed and monitored for risk items through the clinical portal.
As to our early successes, we were fortunate to win some awards and get some recognition, and our first pilot was successful with green lights across the board in terms of people finding the app helpful, using it routinely, and us seeing symptoms and well-being improving. As for our current state, we have federal funding for a feasibility level randomized controlled trial here in Toronto. We are following a path to get FDA approval as a digital therapeutic. We have real-world pilots happening in clinical environments, ramping up in CAMH and in other jurisdictions, and we have 2 patents underway in terms of the digital hallucination detector. The Expo couldn't come at a better time with the opportunity to help us cover some key costs in areas of FDA approval as a digital therapeutic, EMR integration technology, and continuing to iterate and offset some of the setbacks we had with the pandemic. On behalf of the A4I team, thanks so much, and we'd be thrilled to answer any questions.
ask the first question. Thank you very much for that presentation. It's really, really exciting to see the progress you've already made on this solution. I guess the question I would have is, and I might have just missed it in the very beginning of the video or the presentation, the extent to which you're co-designing with patients. Can you just describe a little bit more about that process, Sean?
Sure. Yeah, just very briefly. From the very beginning, we started, and I think this is one of the reasons why we really valued the partnership with Memotex, is Memotex, their process in developing digital health approaches starts at the grassroots level. We did paper prototyping, early conversations with individuals with psychosis, their family members, with psychiatrists and other care providers. So from the very beginning, it's just been continuous iteration through our early beta testing, our first pilot, after that pilot, and then we're continuing to collect information to this day. And the one track is the randomized trial, which we're going to be iterating further based on feedback there, but as well our real world pilots, both in CAMH, which are getting underway. I think it came up earlier about process, is we're really wanting to hear from clinicians and patients about how to bring this into the real clinical environments. So it's continuous iteration.
So can you hear me, Sean?
Yeah.
Yes. My question was about the spectrum of illness of individuals with schizophrenia, and it's intuitive to me how individuals who are doing reasonably well, even moderately well, could capitalize on this. Is there a process for drawing in individuals who are at the more severe end of the spectrum, or either through decision makers, family members, or outreach in any specific way?
Yeah, for sure. Yeah, and I'll answer that in a couple of ways. I guess first is, as many on this call know, you can have two people with the diagnosis of schizophrenia that don't resemble each other at all. It's just such a diverse spectrum, really, of illnesses. And so we have an algorithm on the front end where a few straightforward questions tailor content, tailor what A4I does for the person. That's been key. And other pivots we've had. It works on Android and iPhone, and as well, recognizing that many don't have robust data plans, this works well with data hoppers. So people can access it that way. And really, we see this as less something people would go to a virtual store to find the app on their own. It's really to be grounded fundamentally in the clinic. So where providers and care providing organizations would have access to licenses, and they in turn would provide it to individuals across the spectrum, whether they have fewer functional challenges or major challenges. And the last point I'll say is that we've really found that people with schizophrenia across the board have felt left out of the digital health conversation, unlike mindfulness for anxiety, where you have thousands of options. So people have been quite keen, and we have people engaged who are full-time employed, right on through to folks that have much more profound struggles.
Thank you.
Hello, thank you for that. I really enjoyed the presentation as well. Maybe a two-part question, if I may. So far, you've gotten a lot of green lights on the product, and obviously a lot of good early successes. What do you think the biggest obstacles will be in the next 3 to 6 months for you folks in getting your business and moving it forward? The other part was just around the user experience and user design of your product. What considerations are being made there to ensure that it's the best possible experience for the end user? And is there any special requirements needed for people with schizophrenia?
Okay, so maybe I'll move your first question over to Amos to speak to the business end and priorities in the next 3 to 6 months.
Hi, thanks. Thank you for that. For the first 3 to 6 months, I really think our priorities are obviously valid. And we have this CIHR funded control that is underway. So that's a big part of what we're doing. The co-design and iterating based on sort of what you're design, that's important to us. The FDA sort of pursuit of device.
Yeah, I think Amos is cutting in and out, so maybe I'll just jump in quickly and speak slightly out of my lane on the business end of things. Abdullah, I think you probably are very well aware we're this space. Sometimes it's called the Valley of Death, I think, where you got your beta, things are working well, early indicators are looking good, but we're too early for venture investors at this stage. And we're in this sort of funny place where we've had investors watching us and interested in our path, but we've got to get to seem more and more real, to be more and more validated. The FDA approval as digital therapeutics, a key piece, trial data, clinical validation data. And there's a lot of interest in risk prediction. Unlike depression and anxiety, people with psychosis are getting unwell. The indicators are more overt. So people want to see us get data to help validate that. So I think those are the key pieces. And really, it's for us, it's kind of keeping up momentum in this strange space we're in, where we've passed the early pilot stage. And we're starting to get signals from investors. So that's I think the key thing for the next 3 to 6 months for us. And as for your other question about keeping people engaged, is we have a patient in residence who's a part of our leadership group who gives us real-time feedback all the time. And we're just constantly engaging a range of individuals and communities with schizophrenia, spectrum illnesses, and getting feedback on everything process to tool. The last thing I'll say is A4I is a bit of a plug-and-play setup. We've started with schizophrenia, spectrum illnesses as our first indicator. We're also in discussion, we really ultimately want to become a tool for complex behavioral health. It can be adults with mild to moderate developmental disability, addictions, bipolar disorder, other areas. It's modular, so you can kind of plug in different pieces. So that's in our pipeline too. I'll stop there.
So thank you very much, Group 2. And our final group presenting is the Pocket Skills Project.
Hey Dragons, my name is Alex DeRoss. I'm a psychologist and researcher at CAMH within the Addictions Program. I'm here to talk to you today about our innovation called the Pocket Skills Project. So here's the problem. More than 80% of people referred to the CAMH Addictions Program endorse multiple mental health concerns, such as depression, anxiety, along with their substance use concerns. Even with multiple treatment options available, demand currently exceeds all offerings. So our innovation focuses on increasing accessible treatment options for those with co-occurring mental health and substance use concerns. Our innovation targets a dimension that underlies multiple conditions called emotion dysregulation. This core difficulty in regulating emotion arises because individuals with mental health concerns use maladaptive strategies and substances to cope with negative moods, and sometimes positive ones too. Studies have shown that individuals with mental health and/or substance use concerns benefit from learning new strategies to regulate their emotions in more adaptive ways. Our innovation incorporates dialectical behavior therapy, an intervention that improves emotion dysregulation by teaching people skills to regulate their emotions. DBT was originally developed by Marshall Linehan for highly suicidal individuals and is highly effective. However, access to formal DBT is incredibly limited because it is lengthy, face-to-face, and requires multiple clinicians. Newer, briefer DBT skills training formats have been developed and are effective in reducing mental health symptoms, suicidal ideation, and substance use in as little as 8 weeks. Skills training is traditionally pen and paper in nature, and it lends itself well to these new evolving digital innovations. So you must be wondering, isn't there an app for that? Introducing Pocket Skills, the only existing DBT web app with evidence-based support for mental health and substance use concerns. It was developed by Dr. Wilkes, our external collaborator, along with Dr. Linehan. It can be used as a standalone intervention or in conjunction with a weekly guide, which has enough content to last 8 weeks. eMarsha guides the user through more than 25 DBT skills, including those related to addiction. Short videos featuring Marsha Linehan herself are incorporated in a chatbot facilitates discussion and practice. The app is ready to use, low cost, and not for profit. While ready to go, we need to evaluate Pocket Skills in an outpatient context and gather lived experience feedback with regards to content and implementation. Waitlisted participants will be randomly assigned to receive 8 weeks of Pocket Skills in one of 2 formats. This will allow us to evaluate not only the therapeutic benefits of the innovation, but also how best to implement it. All individuals will receive our intervention. The clinical monitoring participants will receive a weekly email check-ins and assignments, whereas those in the coaching condition will receive follow-up calls to review skills and practice with a paraprofessional coach. Clinical outcomes will be evaluated every month during the intervention and during a follow-up of 2 months. This is a really unique opportunity to accelerate the digital innovation initiatives at CAMH. Aligning with our innovation pipeline, we will empirically evaluate this evidence-based intervention, support and enhance care, and create partnerships with other researchers and institutions. We envision Pocket Skills as the first step in offering digital tools across multiple addiction programs and services. It is a true integration of clinical research and training. And with that, we hope you'll consider Pocket Skills so that we can help put skills back into people's pockets.
Alex, if I can ask you a question just regarding, the solution that you've obviously been able to source. Would you leverage all the, assuming that you do win the prize, would you actually leverage all the funding to fund this application with Dr. Marsha?
Yeah, most of the funds are actually going towards staff. We need a few additional members to sort of run this project and integrate, trainees actually, because we're both licensed psychologists. We could support junior colleagues in this work. Only a small portion of the funds are actually going to hosting the app and paying for the ongoing maintenance of storage and like 24/7 access. And so most of the funds would be, we would obviously take some of that money and sort of figure out ways to keep it going in the future. So some of that involves like applying for federal funding to get that to extend.
Another question. So fantastic idea. I love the integration concept across multiple services, and I guess that's kind of where my question's coming from. How do you envision sort of incorporating and aligning, I guess, the service, how this would be used across multiple services and incorporating it into their programs in an integrated fashion that actually is intended to kind of get at the value that you're looking for the patient?
Yeah, excellent question. We want to do that carefully, obviously. This app can be used as a standalone intervention. It can also be used as an adjunct. And so we want to, right now we're working with the addictions program, and we have sort of engaged in those discussions with the leadership team, and they're totally in our kind of they're totally supportive. But in terms of other departments, we would want to obviously talk to the management team and sort of see how that could play out and actually study that as well. I don't know, Elena, if you have any other thoughts there.
Yeah, I would just add that we're particularly excited about exactly that potential for integration, and we're working closely with both clinicians and clinical operations and leadership to see not only how can this work with our internal care pathways, but also the broader health system, so that we can think about longer term opportunities for scalability and sustainability. Of course, with full collaboration and partnership with our collaborators in the US, Doctors Lanahan and Wilkes.
So I'm learning that earlier on, some of the questions were not picked up by those streaming. And so I want to ask Dr. Catherine Zahn if she could ask her question again for those who are on streaming so that they can hear both the question and the response. And then I'll ask Abdullah to do the same.
So this is a very interesting concept. My question is born out of a concern for understanding how access to this to dialectical behavioral therapy is so constrained in our organization. So the question is are you going to be able to identify, screen out, or adapt for individuals who are more severely ill and actually are inappropriate for the use of this app? Will you be able to identify them and get them to the right treatment?
Yeah, so we acknowledge that we wouldn't want to use this as a standalone intervention for people who are acutely suicidal or perhaps require more care. But we actually see this as a great opportunity for a large spectrum of different clients that CAMH sees, and that includes people with addictions and mental health, concurrent mental health disorders and symptoms as well. So we think that those who don't have acute suicidality would be perfectly fine on this app, and we're also going to be monitoring them as well.
And my question was just really around how Alex and co plan to leverage resources if they would be the winning team today, and in particular, what's the divide between funding the app itself and supporting maybe people to kind of help the back end and talent and staffing and whatnot.
Right, and so most of our requested funding is going towards staff, and as psychologists, Lena and I will be able to supervise junior trainees to sort of run these types of projects. Only a small proportion of the funds are actually going to go to hosting the app, which will give us 24/7 access and data storage for each of the participants that we intend to run.
So thank you very much for all three finalists for your presentations. The judges will now be debriefing to determine the winner of the pitch competition. In the meantime, we'll be running a draw for some prizes. And so here's how it's going to work. You can see a QR code on your screen, and we'll also be putting up a link. This will go to a survey. Fill out the survey, and you will be entered into the draw. And we'll give you a few minutes to do just this.
We pitched a suicide safety plan app. That's basically a mobile application to keep people who are having suicidal thoughts safe. I think we had a great idea, but there were so many other great ideas today. So I'm really thankful.
The final winner of our expo competition. And so virtual drum roll, please. We have two prizes today. We have two Samsung tablets, and our winners are Tony I and Eileen S. So members of our organization committee for today's expo will be in touch to arrange how you will get your prizes. So congratulations to our raffle winners. Now here is the moment, and now is the moment you've all been waiting for. I've just been informed that our judges have made a decision, and before we reveal the winner, I will be passing it over to Dr. Damian Yankovic to provide a few words and thanks.
Simply fantastic ideas. Thank you very much. I can't wait to hear what our judges decided, and I wouldn't want to be in their place. But before I turn it over to Catherine to announce the winner, I would like to thank Laura Manley, our keynote speaker, as well as Catherine Zahn, Abdullah Snowbar, and Lydia Lee for being such amazing dragons. Thank you to the three finalists, as well as to 21 teams who have submitted an idea. Thank you to the selection committee, very important, 15 individuals from across the organization for your time in reviewing and selecting the finalists. A special thank you to the Gifts of Light and Donna Slate, as well as Cerner for sponsoring our Innovation Expo. Couldn't have done it without you. Thank you to Public Affairs for amazing coverage of the event, as well as to Wooden Panda team for video conferencing and streaming support. You made our virtual expo look spectacular this year. Last but not least, thank you to our Innovation Expo Planning Committee, Navi Bapre and David Ian, who worked tirelessly over the last 8 months to ensure everything was organized, coordinated, and perfect for this special day. Without further ado, I'd like to pass this to Catherine to announce the winner of our CAMH pitch competition.
So first of all, I'll start by big congratulations to all three of the teams for fantastic work and fantastic presentations. And we deeply believe that all three of these initiatives have a positive future, and we encourage you to continue along with the work. I want to throw in an extra thank you to Donna Slate, who has been such a supporter of CAMH and in initiatives like this. And so for the announcement, I want to say that in recognition of opportunities for real impact in the here and now for an often overlooked and underestimated population, the winner of today's competition is our A4I team. Congratulations.
It's amazing. Thanks very much. We're
Awesome.
really excited.
Amazing.
This is really going to make a difference in our trajectory, and what a wonderful opportunity to be recognized in this way. So thanks very much.
Thank you, indeed.
Thank you for your great work. And as CEO, I couldn't be more proud of the day-to-day innovation that's undertaken by every single individual who works in this organization. So thank you all.
Thank you.
Thank you.
So congratulations. This is a hearty congratulations to the A4I team. This actually officially concludes our Innovation Expo for 2021. Thank you to everyone who made today a tremendous event, and I wish you a wonderful rest of the day.